Yeah, good morning to everyone. I'm very glad to be here to present you an integrated sensorized platform for environmental monitoring healthcare in the framework of the Odin project. I'm Simona Gandah from the Bio-Medico Institute of Scuola Superiore Sant'Anna. The European project Odin is a multi-center pilot study that focuses on the development of the European Smart Hospital of the future, with the aim of enhancing hospital safety, productivity, and quality. This general aim has been translated in four main goals. They start from the creation of a unique digital platform empowered by robotics, IoT, and AI, in order to create a demonstrator of a new generation of healthcare services based on the collaboration of healthcare suppliers and providers. The ecosystem of the smart hospital that we have envisaged takes as input the many challenges that the pandemic has given as input to the healthcare services. These challenges may be addressed by exploiting, for instance, robotics, in particular autonomous and collaborative robots, for reducing the workload of hospital staff, but also by exploiting IoT monitoring of the environmental sensing and data-driven management. By now, due to the COVID experience, everyone of us has clearer the importance of hospital space monitoring for avoiding patient overcrowding and aerial transmission of pathogens. According to the World Health Organization, poor indoor air quality is indeed a significant factor for global disease burden, leading to a risk factor of premature death for about 4.3 million of people each year, and is at the same time the main cause of asthma for the 91% of people. The importance of air quality monitoring in indoor space is indeed regulated by the World Health Organization according to specific and strict guidelines that in this study have been merged in order to include also the monitoring of light, noise and pressure levels in order to provide a more comprehensive well-being assessment of both patients and staff. At the same time, the progress of IoT has been considered to be a flexible and useful tool to integrate and fuse data from different sources in order to enhance context awareness in hospital settings. It's in this scenario that we present the transparent robot, which is a modular IoT platform for real-time monitoring of indoor air quality parameters that allows also the data sharing in a secured manner, and it's perfectly integrated with the smart hospital platform that is developed in the framework of the project. The device is characterized by an internal case in which the sensors are anchored in order to allow the proper exposition to the parameter of measurement. And it fosters the integration of an air quality sensor, a sound sensor, a digital light sensor, a particulate matter sensor, and a barometer. They are all connected to a cloud-connected system on module that exploits a custom recharging circuit in order to operate as a wireless standalone unit, with the possibility of being recharged also with a wireless power transfer module in distributed hubs around the hospital. The transparent robot has all the satellite technologies of the Odin platform, deals with the sharing of data through a central server. This leads the technology to be possibly subject to confidentiality, integrity, and authentication risks. This aspect led us to integrate a end-to-end protection through the transport layer security protocol at the firmware level. In particular, this protocol allows the protection of data by employing a public key that encrypts the shared data that then are decrypted at the level of the server. As it is shown in these videos, in which we have the real-time monitoring of the environmental data that are published and encrypted, and at the same time they are decrypted at the level of the server. As mentioned, the transparent robot has the Odin platform as an ecosystem. Here, I would like to depict the general architecture, in which you can see at the bottom side, there are all the CARES, the key enabling resources that are the core of the platform. Indeed, we have the robot, the robotic, IoT, AI platforms within the hospital information system. As you can imagine, to allow the communication between the CARES and the hospital information system is not a trivial task, because all the resources may have their own protocol and semantic logic. And this communication is enabled by an enterprise service bus through the use of specific connectors. In detail, for what happens for the IoT platform, we have a detail here in which we can see that the communication between the transparent robot and the human interface is allowed through the connector and the enterprise service bus. What happens at the level of the connector is both a semantic and syntactic translation. In particular, we have the syntactic translation into the ESB protocol, and the semantic translation into the Kafka language used in the platform. So what we have obtained so far is the development of the platform that allows the real-time monitoring of the data, the integration of such a technology into the smart hospital infrastructure, the integration of security data sharing, and also the validation carried so far in a simulated clinical scenario. Future developments will deal with the development of risk assessment modeling and models for occurrence of airborne pathologies. At the same time, we want to validate and test the technology and the platform in the upcoming clinical trials, like in the pilots carried out in 2024 in the hospital partner of the project, in particular in Poland, in Spain, and in Netherlands. Thank you for your attention.